What on earth is monkeypox, and should you be worried about it? I'm a GP, and in this video I'll explain this and more. Monkeypox is an infection caused by the monkeypox virus, and this is part of the orthopox family of viruses that includes smallpox. The good thing is though that it's much milder and less infectious than things like smallpox. Prior to this year, there had only been 7 cases of monkeypox in the UK in the past 5 years, but this year there's been a sudden spike in cases. As with many viral infections, the monkeypox virus can enter the body and take a few days before it starts to cause symptoms. We call this the incubation period, and it's the time when the virus is replicating and starting to spread around the body. With monkeypox, the incubation period is between about 5 to 21 days. The initial symptoms are similar to what you would expect with most other viral illnesses. So they would include a fever, malaise, which is when you feel generally unwell, headache, sometimes a sore throat and cough, and lymphadenopathy, which is swollen and sometimes tender lymph nodes. One of the hallmark symptoms of monkeypox is the rash, which usually occurs about 3 days after the fever. The rash goes through a few stages before eventually falling off. Initially, it may appear as a flat, macular rash, but then it becomes slightly raised. The next stage, around day 4 or 5, is when it forms small fluid-filled blisters, which we call vesicles. At this stage, the rash can resemble the kind of rash that occurs with chickenpox. However, the rash then changes in appearance from fluid-filled to pus-filled blisters, which more closely resembles the rash that occurs in smallpox. These will remain for around 5 to 7 days before they start to crust over and then form a scab. Eventually these will fall off after about another week, and you are considered infectious until all of the scabs from the rash have dropped off and the skin underneath looks intact. The rash typically starts on the face or the mouth, but can then spread anywhere from the top of the head to the bottom of the feet, and can even be around the genitals. It can take about 4 weeks from the start of symptoms until you fully recover. It generally involves close physical contact, such as touching their skin or coming into contact with their clothes or towels that they've used, or if you've been exposed to any fluids from the infected person. So this could be from coughs or sneezes or during intercourse. So if someone has the symptoms of monkeypox, they're advised to self-isolate to prevent transmission. The good news is that most people recover from monkeypox after a relatively mild illness. However, it can lead to some complications which are more serious. For example, a chest infection or pneumonia, sepsis, which is the body's systemic immune response to a serious infection, encephalitis, which is an infection affecting the brain, and sometimes it can lead to an eye infection. If you're pregnant and catch monkeypox, this may affect the pregnancy and lead to complications. Children also have a higher risk of becoming more severely ill than adults. But I want to reiterate that these complications are not common, and most people will not experience this. Monkeypox may be suspected based on your symptoms and the typical rash. However, we do also need confirmation with a sample taken of the infected vesicles or blisters from the skin. Blood tests can be taken, but these are not as useful in making the diagnosis. As the symptoms are generally mild and the body is able to fight off the virus on its own, most people don't need any specific medication to treat this. However, in some cases, such as when people develop complications or have a weakened immune system, there are a few options for treatment, which includes antivirals and immunoglobulins. We also have effective vaccines that can be used, such as the vaccination against smallpox, which is about 85% effective against monkeypox. We generally would use this for someone who's immunocompromised and may have been exposed to monkeypox before they actually start to show symptoms. I hope this video has helped you to understand exactly what monkeypox is, and hopefully reassured you, as most people recover from the illness without any serious complications. The most important thing to remember is that if you do think you might have developed the rash that occurs with monkeypox, you must contact the NHS 111 phone line and avoid coming into physical contact with anyone else to avoid further transmission. Before you leave, you might want to check out this video on how to avoid getting sunburn, or this video on the recent rise in cases of hepatitis in children. And I'll catch you next time. See ya!